Well, let's talk about MythBusters and insights, shedding a light on UVC technologies in the hospital environment. On the right, we have a recently published paper entitled Shedding a Light on UVC Technologies in the Hospital Environment. In this review of UVC technologies by Dr. Demirsamin and colleagues, we would like to express several concerns with this review. First, the authors appropriately list some of the parameters that affect the effectiveness of UVC irradiation for disinfection. Although beyond the scope of their review, it should be noted that similar factors affect the effectiveness of chemical disinfectants, including concentration, time, duration, temperature, inherent microbial resistance, and the need for the chemical to have direct contact with the microbe. Second, with regard to room disinfection devices, the authors state that most studies reported a 1 to 2 log reduction in microbes on the surface. While this statement is correct, it is also misleading. Studies have demonstrated that UVC room disinfection devices can achieve greater than 3 log of reduction of multi-drug resistant vegetative bacteria placed in carriers. The reason that most studies only show a 1 to 2 log reduction is because that's the average load of microbes on environmental surfaces. And so even if you remove all the microbes, it's still generally only 1 to 2 logs. Third, as noted in the review, HLD requires a greater than 6 log inactivation of microbes. This can be achieved in a sealed closed chamber by UVC for non-lumen endocavity endoscopes, as the distance between the UV source and device is very small. Importantly, UVC energy decreases as a squared function of distance. In fact, one UVC device used for high-level disinfection of endocavity ultrasound probes has been demonstrated to achieve greater than 6 log decrease in microbes, including spore formers such as Bacillus subtilis, thus meeting the criteria for HLD. Fourth, the authors correctly note at the present, a UVC device for HLD has not been approved by the U.S. Food and Drug Administration for HLD of microbial devices. However, they failed to mention that one such device has been approved for HLD of non-lumen endocavity probes by regulatory authorities in France, Canada, and Australia. Finally, the lead author stated that the authors of the paper on UVC disinfection devices for HLD of endocavity probes have a conflict of interest. We take umbrage at this inference that such papers are biased or not scientifically accurate. We note that the authors of these publications disclose the conflicts and that the papers were peer-reviewed and accepted by the editors. Now, finally, MythBusters in review of 2 studies. On the light, you see disinfection of transvaginal ultrasound probes in a clinical setting, comparative performance of automated and manual reprocessing methods. On the right, disinfection of transvaginal ultrasound probes by UVC, a clinical evaluation of automated and manual reprocessing methods. The study protocols between these papers were not the same, so it's not possible to directly compare the results of the data in these 2 studies. Again, you have to, if you're going to compare data between 2 studies, they have to use identical methodology.